Good afternoon. My name is Tara Elrod, and I will be presenting today information on community and public health. First, we'll address what is public health. Public health utilizes a proactive and preventative approach to focus on the health of entire populations while they are healthy rather than individuals after they have become ill. Public health cares for entire communities in the same manner physicians care for individual patients. Community and public health work to keep entire populations healthy through appropriate organizational structure, legal and ethical considerations, funding, and open lines of communication within communities. If public health fails in these areas, entire populations suffer. What does public health mean to the community? For many individuals, when they hear public health, publicly funded healthcare or healthcare services for those individuals that are unable to afford access to healthcare immediately comes to mind. However, in reality, public health is far more widespread, benefiting society as a whole every day. Shortly after waking in the morning, the majority of the population will brush their teeth. Public health plays a key role in the oral health of much of the population through fluoridation of public water supply, which first began in 1945. According to Cohen, fluoridation of public drinking water has resulted in a 40 to 70% reduction in tooth decay in children and 40 to 60% reduction in tooth loss in adults. However, 40% of the U.S. population still reside in areas without fluoridated water. Breakfast typically falls somewhere into our morning schedules, consisting of orange juice, eggs, or a simple slice of toast with a fruit preserve. Public health plays an integral role in the assurance we are consuming foods that are not contaminated with bacteria or other pathogens that will make us sick. Public health regulates the safety of our food supply. Additionally, public health provides proper training and education on safe food handling practices to ensure bacteria has been destroyed prior to consumption to ensure our food is uncontaminated. Once we've had our healthy breakfast, our schedules typically require we drop children off at daycare or school, and off to work we go. It is the public health system that ensures our children are appropriately immunized to ensure that they are not spreading nor contracting illnesses such as measles, whooping cough, diphtheria, or other childhood diseases that could be fatal. During the 20th century, tens of thousands of children were permanently disabled or died due to these types of diseases. Public health engages in continuous efforts to ensure that all infants and children are immunized through monitoring vaccination rates, actively seeking out unimmunized children, and offering immunizations in community and public health clinics. As we arrive at work and move through our day, it becomes clear that we are working and eating our lunches in smoke-free establishments. Years of public health research and actions have led to the increased knowledge that tobacco use and secondhand smoke exposure leads to numerous health disparities and even death. This has led to various actions designated to reduce smoking and secondhand smoke exposure, such as clean indoor air regulations. With numerous national disasters in the news lately, we realize the importance of being prepared for the next potential disaster. While it is difficult to predict what disaster or emergency we may face in the future, we can rest assured that public health officials and practitioners are prepared. We all hope and pray that we will not be faced with another release of anthrax scare, pay witness to another horrifying scene like that of Hurricane Katrina, or another influenza pandemic. Nonetheless, public health is prepared for these disasters and will be the first to respond in cases of local or national emergency to protect communities and the population as a whole from whatever should come next. The organizational structure of public health. The public health system in the United States comprises a multifaceted network of individuals and organizations in the private and public sectors that work collaboratively at the national, state, and local levels to promote and protect our population's health. The U.S. Department of Health and Human Services is the primary national agency responsible for protecting the health of the population and providing essential human services to the American people. According to Hayden Shortell, as a federal program, the HHS serves as more of a source of policy, guidance, and funding, but does not directly administer the programs. The HHS works collaboratively with state and local administrators to make sure that services and information are distributed to the public. There are various agencies that are part of the HHS, to include the Agency for Healthcare Research and Quality, Agency for Toxic Substance and Disease Registry, Centers for Disease Control and Prevention, Food and Drug Administration, Health Resources and Services Administrator, Indian Health Services, the National Institute of Health, and Substance Abuse and Mental Health Service Administrators. State health agencies fall under the direction of the state health or medical officer and are guided by the State Board of Health. State health department structures can vary from one state to another depending on the size of the agency. According to Hyde and Shortell, the traditional public health agency limits its oversight to just public health and primary care services. Other large state agencies will oversee substance abuse and mental health or even Medicaid services. The health or medical officer is responsible for making sure that all programs and services are appropriately implemented and services are provided. The health department is the organization that provides the services necessary in the protection of the health of the general public. At the local level, public health encounters the population it actually serves. Most programs are administered at this level, local citizens are involved on the boards to provide the community perspective, and disease reports are collected case by case and fed to the state epidemiologist for analysis before being forwarded to the CDC for national statistics to be monitored and reported. There are numerous legal and ethical dimensions of public health. According to Gostin, the preservation of the public's health is among the most important goals of the government. Enacting and enforcing laws is the principal means by which the government is able to create the appropriate conditions for Americans to lead safe and healthy lives. According to Grad, the field of public health could not exist in the manner in which we know it today except for its sound legal basis. Various laws have been enacted to safeguard the public's health. For example, the Privacy Act of 1974, which is intended to safeguard all individual privacies from the misuse of federal records, which include those under Medicare, Medicaid, and other healthcare services. Additionally, the Emergency Medical Treatment and Active Labor Act of 1986 ensures all individuals have the access to emergency care regardless of their ability to pay. While these laws do not seem to infringe on individual rights, some legal dimensions of public health can appear to violate individual rights, such as seatbelt laws. While these laws may appear to infringe upon an individual's right to choose, they have been enacted for the greater good of the majority. Additionally, an individual's right to choose is not violated, as one can choose to not wear a seatbelt and pay a fine. Personal choice is still present. Public health ethics seek to understand and clarify principles and values that guide public health actions, offering a framework for decision-making and a means of justifying decisions. Dimensions of public health ethics comprise a number of moral considerations, such as producing benefits, typically health benefits, but not limited to, often interpreted in policies that maximize the greater good and prevention of harm, typically health harms, such as preventable morbidity and premature mortality. Additionally, fair distribution of social goods, or health benefits, as well as respecting individual autonomy and liberty of action. Funding of public health. For too long, the country is focused on treating people after they become sick instead of preventing diseases before they occur. As the economic state of our nation continues to ride the roller coaster of recession and economic rise, funding public and community health programs becomes more and more difficult. According to a study conducted by Mays and Hogg in 2015, although most of the $2.8 trillion spent annually on healthcare in the United States is attributable to preventable conditions, less than 5% of these expenditures support public health strategies that are designed to prevent and control disease and injury. The Affordable Care Act, passed in 2010, established the Prevention and Public Health Fund, which is responsible for providing expanded and sustained national investments in prevention and public health to improve health outcomes and enhance healthcare quality, authorizing as much as $15 billion in new federal spending over 10 years. The Centers for Disease Control and Prevention receives a funding that is distributed to state, local, and other private and public partners to support programs and services. State and local public health funding varies from state to state and is based on disease rates and other health factors. Federal funding for public health has been significantly cut over the past few years, resulting in more than 50,000 state and local public health workers being laid off since 2008. These individuals being those that immunize our children, monitor and respond to outbreaks and disasters, and ensure the safety of our food. Americans are feeling the effects of policymakers' budgetary decisions on their health, their access to health care, and in some cases, their career choices. Communication is key. In the wake of the numerous national disasters since the Twin Towers came tumbling down in 2011, the importance of our nation's public health system has become more and more evident. Additionally, the public has come to realize the crucial importance of strategic, timely, and effective communication in the public health arena. Communication in public health encompasses mass communication, health education, marketing, journalism, public relations, and epidemiology. Health communication is central to the way our entire community views healthcare, the public health system, and views overall health. According to Healthy People 2014, these processes make up the context and ways professionals and the public search for, understand, and use health information, significantly impacting their health decisions and actions. In conclusion, community and public health play a key role in initiatives, education, and providing healthcare services to the American people. Public health encompasses a preventative and proactive approach, focusing on the health of the healthy rather than ill individuals in an entire population. Community and public health work collaboratively through clear identification of the role they play in our nation's health, ensuring sound organizational structure, considering legal and ethical dimensions of population health, adequate funding, and concise communication with the public. Without a strong foundation in all of these areas, communities and entire populations are at risk.